Hello and welcome to all of you interested in sleep medicine. This is our 6th episode, and today we'll be looking at how we record breathing. My dear Nikki, thank you for volunteering to be our test subject.
My pleasure.
And now I can show all of you, using this model, this living model, how we attach the sensors both in the sleep lab and for patients at home, and explain what purpose they serve. The first thing we're interested in is the airflow. In other words, is the patient, the person, breathing, yes or no? And for that, in this case, we use a nasal cannula. It looks like an oxygen cannula, but its actual job is to measure the pressure of the airflow. Think of it like this. When the wind blows, you can feel the pressure against you. This nasal cannula allows us to measure that pressure. The second method takes advantage of the fact that exhaled air is, of course, much warmer than inhaled air. So an additional thermistor can be mounted in this area, which allows us to visualize inhalation and exhalation, so to speak, through the difference between warm and cold. The next important parameter for these recordings are the chest and abdominal belts. And these are very easy to attach with Velcro. They shouldn't be too tight or too loose, and they show us the expansion of the chest during inhalation and its contraction during exhalation. When we're talking about central sleep apnea, there is no breathing movement at all. That means these two belts won't provide a signal, and no signal can be measured at the nose either. However, in the case of the most common type, obstructive sleep apnea, we get no signal from the thermistor or the pressure sensor, but we see clear attempts to inhale and exhale, which unfortunately, due to the blocked airway, do not result in any airflow. And the last piece of equipment, so to speak, is mounted here on the index finger, the pulse oximeter. It has two functions. First, it shows us the oxygen saturation in the blood, which of course will drop when breathing stops. And second, I can also use it to measure and record the pulse wave, which in turn allows the heart rate to be calculated. So, with this setup, more or less, we have the cardiorespiratory signals, that is, the signals coming from the heart, circulation and breathing, all included in our recording.
What we don't have on him right now are 3 ECG electrodes, one here, one there, or 2, yes, depending, you can use 2 or 3, which would also, so to speak, record the ECG as well. Then we'd have all the channels, but our focus today was on the respiratory channels, and those are all here.
And what's still missing is the small microphone here on the neck. This would be used to record snoring sounds, although those can also be calculated from the pressure data from the nasal cannula. This means we either use a microphone for snoring, or the sound is interpolated from the pressure readings in that cannula.
No, but that just shows you're a bit of a dinosaur. We really hardly use microphones anymore. The technology in this has become so sensitive that we can basically get everything from it now. It's one less device to attach, which is an advantage in itself.
But I mentioned it for a reason, because many patients who are still fitted with a microphone on older devices ask the question, are you recording what I say in my sleep? And of course that's not the case, because those signals from the microphone are also just converted into waveforms.
Yes, as Rainer already said, whatever you say in your dreams, that's your business. We're not interested. At most, we'd see it on the video recording, but that runs without a microphone. So to see how these channels are displayed on the computer during a sleep lab recording, let's go back to the sleep lab in Bolzano and take a look at the screen. Yes, Heike, I believe what we have here on the screen for our viewers is a normal breathing curve. If I'm seeing this correctly, perhaps you can describe it for us. I think I also mentioned during the presentation that we no longer work in 30-second epochs, but rather evaluate in 5-minute segments.
Exactly. We're seeing the breathing over 5 minutes here. Up here we have our flow channel. That's the nasal flow cannula that we attach during the setup. Thorax, that's the chest movement. Abdomen, the movement of the stomach. And as you can see, you see nothing. It's a completely regular, even wonderful breathing pattern. The amplitude of the breathing doesn't change at all. And the oxygen level in the blood also remains constant. You don't see any snoring. So this is what we have right here.
You would consider normal. Maybe we can count them now. We have a total of 30 seconds here. So let's count. Our 30-second epochs are still shown here. And now let's count 1, 2, 3, 4, 5, 6, 7, 8, 9 breathing cycles per half minute. So that would be 18 times per minute that the person was breathing. And what we also see is the oxygen curve down here, and it's consistently at 97%. Looks great, doesn't it?
Super.
So this is the kind of breathing we like to see. Can you maybe briefly show us breathing in REM sleep, because that's not quite as regular?
So you can see that the amplitude here is a bit reduced and a little more irregular. And the oxygen also fluctuates by about 1%. How can you explain that?
Yes, how can we explain that? You mentioned that the muscles are essentially switched off. That also applies to the respiratory muscles to some extent, and because they are also completely relaxed, so to speak, and no longer work as consistently. By the way, it's the same with the heartbeat, right? The heartbeat then becomes more irregular during REM, which actually helps the heart to recover. And our breathing also becomes a tiny bit more irregular during REM sleep by nature, even if it's not a great normal breathing pattern than it is in deep sleep.
Exactly, and that's what we just saw, deep sleep with regular breathing. Good.
From the overall analysis of all the recorded signals, we can now calculate sleep and with it, sleep quality. And we also need that to be able to diagnose various sleep disorders.
How we differentiate between various sleep disorders is something we'll cover in more detail in future episodes. In the next episode, we want to tackle a topic that will probably interest many of you, namely how exactly we've now seen a sleep lab, which is a bit more involved. Yes, how exactly can my smartwatch do this? Or my little ring on my finger? Can't they already completely replace the sleep lab? We'll be talking about that in the next episode. And we'll also be interviewing one of the most well-known experts on this topic. Until then, goodbye, everyone.
And sweet dreams.